Hi friends, today our topic is CA bladder. CA bladder is that the cancer begins in the bladder. The cancer cells form in the tissues of the bladder, and it may also affect the urothelial cells which we found in the bladder, and it also lines the urinary tract, the ureters, renal pelvis and all that region. So now we will focus on the etiology or the causes of the CA bladder. The first one is the smoking. The person who is smoking a lot may be having CA bladder in the future. Increased age, old age people will have the CA bladder. Being male, so male is more males having more chances to get CA bladder. Exposure to the certain chemicals, the previous cancer treatment. If the person is having cancer previously, so he must be having the cancer and the chronic bladder inflammation. Now we will focus on the symptoms of the CA bladder. The first one is the blood in urine, which we also called as the hematuria. The second one is the frequent urination. The third one is the painful urination, and the fourth one is the back pain. Now we will focus on the types of CA bladder. The first one is the urothelial carcinoma, in which the cancer begins in the urothelial cells of the bladder. The second one is the squamous cell carcinoma. The cancer begins in the squamous cells of the bladder, and the third one is the adenocarcinoma, which begins in the mucus secreting gland of the bladder, mucus secreting glands. Now we will focus on the diagnosis of CA bladder. The first one is the cystoscopy. It is the procedure through which the scope, called as dissectoscope, is inserted inside the bladder, and no incision is necessary for this. This procedure is also called as TURBT, means transurethral resection of bladder tumor. So a small part is taken and sent for checking whether the tumor or the cells are cancer cells or not. So second one is biopsy. First one, as we studied earlier, the cystoscopy, they take a part of that tumor and send for the checking whether the cells are cancer cells or not. The third one is the urine cytology. This is a routine urine test, and the fourth one is the CT urogram. Now we will focus on the treatment of CA bladder. The first one is the surgery. In this, they will remove the bladder tumor. The second one is the chemotherapy. It is the intravesical and the systemic chemotherapy. Systemic chemotherapy means the chemo drugs are inserted through the blood vessels, and the intravesical means the proper chemotherapy is given in the bladder. The third one is the radiation therapy. The radiations pass through the bladder, and the fourth one is the immunotherapy. After the bladder cancer, the person will be not having that much immunity, so the fourth one is the immunotherapy. So the immune drugs are given to the patients. So in this bladder, CA bladder, we have learned the etiology, the symptoms, the diagnosis, the types of CA bladder and the treatment. Hope you understand it.